ready to download those very valuable insights on, the importance of nutrition for us and practical examples of ways in which we can improve maternal health outcomes and improve, even the outcomes for the babies as well. So welcome once again, everyone. Astrida, please, you can move to the next screen next slide so that we can go right into it. Thank you so much. All right, so we're going to take the time to just play a quick video clip of our Complete Health app before we go right into telling you more about us, about our session, and about, having the main presentation from our speaker. Astrida, over. Thank you.
Hello, in this tutorial, I'll walk you through the sign-up process on NaviHealth. The first step is to enter navihealth.ai into your web browser. Next, click on the sign-up button you can find below. Choose from one of the options to register either as a patient, facility, or healthcare provider. Input your details. You can use a registered phone number or email address of choice, but please note that using a registered phone number is compulsory. Make sure to create a strong password. Once you have done that, click on the Finish button to be redirected to input the 6-digit verification code. Get this code sent to your email or your phone number and click to verify the button to complete the sign-up process to get started on NaviHealth. Once the sign-up process is complete, search for a healthcare service close to your location, and once the result pops up, you can search for a facility close to your location. Once you search for a facility, you can click to leave a review on that facility. Make sure your reviews are 100% authentic and original. Input a display name which is not your profile, and thank you for using NaviHealth.
Wonderful. Thank you, Astrida. So just like I mentioned earlier, this is Digital Mom Projects tele-education session. And essentially, our goal is empowering women of reproductive age, providing comprehensive support to them in the states where we're implementing, and even other states, Lagos and Ekiti, to, just build their physical, emotional, financial well-being, equip them to better manage their chronic disease conditions or their regular health needs, build self-efficacy, right? And take control of their finances. And it's very important for us that we are empowering women. If we're empowering women holistically, then nutritional vulnerability is an important part or element of that work or of that goal. We recognize how nutritional vulnerability does affect, maternal outcomes, and we'll see in subsequent slides some of what the data is showing us and why we're intentional about improving the capabilities of our women, especially even in light of what's mDoc's innovative solution to improve or to address nutritional vulnerability solution. Next slide, please. So, Astrida, please, can you change slides? All right, it's changed on my end now. Thank you so much. Just give me a second. Okay, so a quick run through of our objectives for us on the Digital Mom Project. Like I mentioned earlier, our goal is to empower women of reproductive age, supporting them, to improve their health and well-being holistically, addressing all the elements or factors that affect or impact access to care, from physical, emotional, financial. We're also leveraging our the potentials and the possibilities that actually AI health CAM, also developing that to be able to provide support to women of productive age, answer their health questions in a way that is safe, accurate, contextualized, empathetic, and able to provide, and also even serve as an intake coordinator, triaging, categorizing risk, and referring for follow-up care when necessary. Not only that, we are also providing or contributing to health system strengthening by building the capabilities of our healthcare workers. Because if we build the women's ability to advocate for their health, and we don't do the same for our healthcare facilities or for our healthcare workers, it will impact the care that they receive. So we're doing this by providing trainings as well through as well asynchronously, so that we're closing training gaps across the clinical front, quality improvements in the healthcare delivery, also even in digital technologies. And lastly, we're amplifying the voices of the women so that they are able to give reviews, feedback. The way you go to the back in the days when we used to have the suggestion box in the hospitals. Now we have sort of upgraded in that level, leveraging technology. When you go with the Uber or the boats, at the end of your trip, you can leave reviews, or you can, say, share how many you experience on that ride. In that same way, we're also empowering women throughout that to, just provide their feedback on the experience of care, so that we can in turn drive improvements in this facility. Like I mentioned earlier, the data is showing us that there is need for us to address nutritional vulnerability. In 2019, we conducted a previous study, and it highlighted the importance of improved nutrition for maternal health. We saw that nearly, and other data is also showing us that nearly 4 out of 10 women of reproductive age are affected by anemia, or that poor nutrition is prevalent in at least 34% of women of reproductive age. So this is really startling data, and it underscores the importance of today's session. Okay, and just to add, I had mentioned earlier that through the Digital Mom Project, one of the ways that we are addressing this maternal nutritional vulnerability is through our garden in a box solution. It's an innovative garden in a box. As you can see in the picture, the woman holding that box. It's a pre-fertilized seed tape that contains about four fruit and vegetable combinations that can be planted with little to no gardening knowledge or resources. And, it's helping to improve food security, as it can feed at least a family of one, and ensure that, the meals of the women are balanced and integrated with adequate nutrition, or nutrients, I beg your pardon. And it is important to see that we are driving this through the women that we are reaching and serving, women who upload or who are onboarded on our Complete Health app, which I'll speak a little more about. As you subscribe and you actively participate in your care journey, these women are eligible to receive these boxes to encourage positive, healthy lifestyle changes. Ashwada, please, you can move. But before we go on, I'm just going to take the time to acknowledge our subject matter experts. These are men and women, seasoned in their field of study, who are very good at just confirming that you can still hear me. Can anyone still hear me? Just confirming.
Yes, Lisa, you're loud and clear.
Okay, great. Okay, great. Okay, great. All right. Thank you so much. So I wanted to just take the time for the amazing wonderful people who have in the past contributed to knowledge, building the capabilities both of the women and the men that we serve, as well as our healthcare workers. I want to thank you for in the room today. We especially acknowledge and appreciate you. Quick housekeeping rules as well. I wanted to reiterate and let us know that we are leveraging the ECHO model. So it means that we'll be collecting data on your participation in this session. No worries at all. Your data will be confidential and handled by authorized personnel, but we encourage you to please participate in the polls and the quiz questions, and please engage in the comments, ask questions. The speaker is ready and able to provide response to your questions. We expect you to come loaded with the questions, right? And to respond as the session goes on. Okay. We'll be sharing a PDF version of the slides after the session as well. The session will be recorded, so not to worry, you will get information about the session afterwards. And please, to encourage you to have your cameras turned on. Let's feel like we're all in the same room. If you need to speak, please kindly just use the raise hand feature in Zoom, or chat, and we will respond to you. But we are happy for our members on ground provide support for you in case you have any technical glitches. As you know, through our agenda, we're going to go right next into our pre-quiz, and then our speaker will come give a didactic presentation, and then we will have an ample time conversation. My apologies. I think the network got bumped off a little bit there, but thank you. I'm back. Just confirm that you can hear me, please.
Yes.
Am I still very audible? Okay, great. Yes, apologies. Okay. Thank you so much. Ashwada, please, you can move the screens. Yeah. Okay. Thanks. So I was just quickly highlighting who we are as mDoc. We're a digital health social enterprise, and we are providing self-care support for persons either living with chronic disease conditions or regular health needs, providing the right lifestyle modifications that they need to better advocate for their health and live healthier, happier, and longer lives. And we're doing this through a four-pronged approach. Sridhar, please, you can move the screen. The first, which is our Complete Health app, which is our coach-led platform for where members can get access to coaching support. They can track and monitor their health metrics. They can build their self-efficacy, around medication adherence, follow-up of their appointments, exercise, nutrition as well, and even emotional wellness support. So it is holistic. It's a full package. And that's why we play the video at the beginning, because we want to encourage everyone. If you're joining us for our session today and you're not on the completed app, you are missing out, right? You need to sign up today. And members of the team will drop the link in the chat. You can go on Google Play Store if you use an Android phone to download and sign up. If you use an iPhone or a basic phone, you can sign up on our web platform as well at www.mymdoc.com, and start to benefit from the amazing programs that we have on Complete Health platform. Okay. Additionally, I spoke about how we're amplifying the voices of the women. We're ensuring that, when you go to the facility, first of all, you even have a database, like Google for hospitals, to find hospitals around you that provide the services you need. And you can also leave reviews on the kind of service you received. Was it pleasant? Would you like, are there improvements you're seeking? And these facilities can take your feedback to drive improvements in the care that they deliver to you. And then, just like we're having today in today's session, the mDoc Quality Network, which is our platform for providing, capacity building trainings and knowledge sharing, both for healthcare workers and for non-healthcare professionals as well. And lastly, our Nudge Hubs. So even though we are very technology driven and very digital focused, we also recognize the components, the importance of the components, of the in-person components, so that we are augmenting the support we're providing digitally. You can walk into our community hubs or kiosks, right, to access in-person care, track and monitor your health metrics. Next slide, please. But we will go right into it. Next slide. You can please skip. Please skip as well. And we will take our pre-quiz right about now. Dorothy, just confirming that you can please launch the pre-quiz. I'd like to encourage everyone who is in the room today to please participate. We will also share a Google link form for those who are not on Zoom, who will be joining us via YouTube, so that they can participate as well. Thank you very much, everyone. All right, this is encouraging everyone. Please make sure that you are participating in the quiz questions. Don't worry about the answers. Your answers are completely anonymous. This is so important for us so that we can measure knowledge gain, right, for this session. So please, we want to see your understanding of healthy nutrition, some of the important components, and how that changes at the end of the session. So the pre-quiz is up now. Please, we will also share the Google form for YouTube for those who are joining us via YouTube who are unable to participate via Zoom, or those who have technical glitches. If you can't see the pre-quiz, please let us know in the comments or in the chats. We'll be able to support you. But you can also look at the very bottom of your screen. You will see 3 dots or more written on that. Once you click on that, it will bring up the questions for you, the quiz. So please make sure that if you're in the room, you're participating in the pre-test quiz. Thank you so much, everyone. Thank you, everyone. Please keep your answers coming in. Thank you so much. I think I see someone has a feedback. Chioma says a pre-quiz. It's not coming up. Chioma, is that a challenge? Please let us know how we can support you. Thank you everyone for your answers so far. Please keep them coming in. We have just a few minutes to go before we round up the pre-test quiz. So we'd like to encourage everyone who's in the room to participate as well. Thank you. We're doing so good. We have just a few minutes more, please. Just encouraging everyone. Please make sure that you participate in the pre-test. It's just 8 questions, okay? So I want to encourage you, please make sure that if you're in the room, you take the questions as well. Thank you so much. We have just 1 minute to go. I'd like to encourage everyone, if you've already started, please make sure that you participate in the pre-test quiz as well. Thank you. We're waiting for you to round up. All right. Thank you. Thank you. Right, just a few seconds more and we'll bring the poll to a close. All right, thank you so much, Dorothy. I think we can bring this to an as we go right into next session. Astrida, please, if you kindly just all right, I'm excited and honored to introduce to us our guest speaker for today, Udeme Umar, lead dietitian, Penal Nutrition Hub, researcher, and public health advocate. Udeme Umar is a passionate registered dietitian and nutritionist with nearly 7 years of professional experience, specializing in medical nutrition therapy. Our expertise lies in utilizing evidence-based nutritional strategies, which is important to us as mDoc here, counseling to foster health promotion, disease prevention, and the management of chronic health conditions. We couldn't have brought anyone more better to come to today's session, right? Driven by her passion for advancing public health, Udeme founded Meet the Food Doctor, a platform that empowers individuals to harness the power of nutrition for wellness and improved quality of life. She's a registered dietitian and licensed dietitian and nutritionist, and an active member of the Nutritional Society of Nigeria, as well as the International Confederation of Dietetic Associations, Institute for Dietetics in Nigeria as well. She holds a BSc in Food Nutrition and Dietetics from Obafemi Awolowo University and an MSc in Public Health Nutrition from the University of Ibadan, where she specialized in clinical nutrition and diet therapy. She completed a clinical training at Lagos University Hospital and has worked in several tertiary health institutions. Additionally, Ms. Udeme has provided consultancy services to various private hospitals, and she's catered to patients with a diverse range of conditions, including diabetes, hypertension, anemia, Parkinson's, cancer, fertility, fibroid issues, and the works, right? However, our extensive experience extends beyond clinical practice to other diverse roles in research and public engagements. She has delivered impactful presentations to corporate organizations, government agencies, forums for women like we're having today, religious organizations, and many more. Other interactive platforms focusing on children, adolescent health, antenatal, breastfeeding practices, maternal health, nutrition, and other healthy practices. She has also been featured on radio programs, and which further amplifies her reach and impact. Her commitment to advancing knowledge is evident through her contributions to research. She has served as a research assistant, a research dietitian, and supervisor on various national and international projects with organizations such as TEDFund Project on Malnutrition, Save the Children International, the World Health Organization, and the International Vaccine. Astrida, please, if you could just remove your cursor, it's blocking my screen. As well as involvement in urban malaria studies and local and state projects in communities. Mrs. Udeme is we can't wait to hear from her today, right? She is a seasoned speaker, a seasoned expert. I want to see us start expressing our excitement and delight had I been on the podium today. So I want to see the claps in the chat. I want to see the pom-poms as well, just expressing our delight at the wonderful and seasoned, value-loaded conversation we're going to have today. So, ladies and gentlemen, without much further ado, it's my pleasure to welcome and hand over the mic to our esteemed guest speaker. This is Udeme Omo. Over to you, Ma. You're welcome. Thank you so much.
Thank you so much, Lizzie, for having me. Hi, good afternoon, everyone. We look all very serious. Okay. I can see
well,
the
I don't look serious.
Don't be serious. So it's not that we're not doing the exam. It's not a lecture room. It's just a conversation. It's for me, it's like a health talk, like we usually call it. So hello, everyone. There are 33 persons on the call. I can't start calling our names, because our time is fast spent. So it's such an honor. Thank you, mDoc, for having me. Thank you all, management, leadership, and every valuable person. And thank you for being here. Thank you so much. It's really an honor and a privilege to be here. So if there's any area I'm very passionate about, it's really maternal nutrition, because every other one can be, especially because it involves another human being coming forth. So that's why it's something I really, really love to do. So let's start. Slides are up. All right, so we're talking about nutrition during and after pregnancy. So person is on my all right, so we're talking about nutrition during and after. Even though I would have loved to have it before, during, and after. There's always a before, there's always a during, and there's always an after. So these are just my key points. So next slide, please. Next slide, please. Thank you. Okay, please forgive me. Go back to the last slide. Let me just point out a few things. Okay, so in the next few minutes that I have, we'll just be talking about a few things. Introduction, what's the importance of nutrition in pregnancy, essential key nutrients, what are the food sources of the essentials, common nutrition-related concerns in pregnancy, food beliefs and myths, nutrition after pregnancy, breastfeeding nutrition, question and answers. Next slide, ma'am. Okay, before we go, I think this is really, really blocking me. Let me bring it to this other end. Can you see me? Can you still see me?
Yes, we can, very clearly.
Okay. So if I ask you now what's nutrition, I'm sure we've heard. Is there anybody here that does not eat? You've not eaten in the last 72 hours. Let me see your hand. Just give me one emoji. You've not had anything to eat in the last 72 hours. You've been fasting, you've been praying for us, you have been, So nutrition simply means food at work in your body. That's just a summary of nutrition. As simple as it is. Sometimes when they are doing constructions on the road in our different cities, you will find this placard on the road. They'll say, so they will say, men at work or road in construction. There's always something like identifying that don't go to that area, or men are walking on the road. So nutrition is just simply food at work in your body. Now, the food can be doing the right thing or can be doing the wrong thing. So as long as everybody's eating, nutrition is going on. But once you now know that nutrition that is going on in your body, is it going on the right way or is it going on the wrong way? And that's why we are here today, especially being that you are a pregnant mom or a pregnant dad, because if you're here and your wife is pregnant, you're also a pregnant dad, you're doing it together, or you're just preparing for pregnancy, or even if you're done with the pregnancy stage and then you are in the post-pregnancy season, you are welcome. So here I'm just saying, look, you can see the slides where saying when you are pregnant, nutrition is more important than ever. So nutrition in other stages, okay, let me just say this, that as a human being, we were not giving birth to today and then the next day you became 35 years or you became 40 years. It started from when you were conceived, when one man and one woman came together and then something happened. And then you now wake up and notice that, oh, what's going on? We are pregnant. You don't know we are pregnant. That's when life begins. So from the moment when a woman is confirmed pregnant, a woman and a man are confirmed pregnant, it's a circle. Then you carry for 9 months and then you give birth. So even when you give birth, the child does not automatically become a school-age child because there are categories for these things. There is baby, there's infant, there's school age, there's adolescence and blah, 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 So there are stages to this thing. So for every stage of nutrition, that you are going to experience, or for every stage that you eat, if you don't give the proper nutrition for that stage, there will be consequences in the next stage. So your nutrition should not only start when you are pregnant. The moment you're thinking, I want to have a baby, that is when your nutrition should start. So I would always tell people that it's better you start planning nutrition the moment you think, whether you're a single lady, whether you're a married lady, when you just think in your mind that I want to have a baby, that's when you should start taking your nutrition important. Now, why am I saying so? Sometimes we are even pregnant for like 4 or 5 months, and then we don't even know that we are pregnant. Sometimes it goes as far as maybe like 8 weeks. So I remember then I met someone that was pregnant in about 4 months, and she didn't even know she was pregnant because she was still menstruating. Those things happen now. So, but what am I saying is that in the first 6 to 7 weeks of life, when a woman is pregnant, all the key organs of the body have been formed. Key organs like the lungs, the brain, the heart, the stomach, and the likes like that. So if you didn't have enough nutrition before you were confirmed or before you found out that you were pregnant, it is the nutrient your body had at that time that will be the fuel for the formation of the organs that I just mentioned now. So if you don't have enough nutrition before that time, it's going to be challenging. So I said now, when you're pregnant, nutrition is far more important than ever. You will need many more nutrients than you did before you were even planning pregnancy. So it's very important that even while you're becoming pregnant, you're not only shopping for baby things, you're not only going for antenatals, but you're also adjusting your nutrition. You're also adjusting, so the preparation doesn't just go about, oh, it's time to start saving more money, or it's time to now, oh wow, we should have to get a better house. This house cannot contain our baby. So you are preparing all those preparations externally, but what happens to the internal one that actually forms the baby? So when you are pregnant, there's already an adjustment that you need to make in your diet. Now there's nutrition and there is adequate nutrition. Like I said, nutrition is just food at work in your body. So adequate means that you are having the meal that you are eating. Now, let me define what a meal is. A meal is the solid and the liquid that you are taking. So we have the liquid being the beverages. It can be tea, it can be anything, carbonated drinks, sweetened drinks, can be yogurt. So anything that is a liquid or a beverage can be considered as a meal. So when I ask people what meal did you have yesterday, you don't hear them say, oh, I ate eba and egusi soup. That's not a meal. It comprises, if we had water, that's a meal. So it's both the food and the beverages that you also had. That's what a meal is. So when I ask you, what meal did you have yesterday? Start telling me from the tiger nut you bought in traffic, tiger nut drink you bought in traffic, plus the zobo that your mommy came and then she just remained some for you in the fridge, to the golden one that you remaining golden one that you had from your first daughter's meal, so everything you've had in 24 hours comprises your meal. So now my emphasis is that the meal that you are having, is it adequate? Because it's possible to be eating and not eat adequately. Adequately means it's enough, like I said, has protein, has carbohydrate. If you've ever gone through school, let's say as basic as secondary school, you hear them say when we're in biology, then they say food contains not like these 5, 6 nutrients. They have carbohydrate, protein, fat, and oil, minerals, vitamins, and water. Now, beyond all of that, there's other things that also comprises that makes your meal adequate. It's what they call phytochemicals and antioxidants. Let me just explain them in simple terms. Like, for instance, your tomatoes. Have you noticed that tomatoes have a particular red color? So that red color has what is characteristic, or what makes that tomatoes red, is something called lycopene. So lycopene is a phytochemical. Phytochemical is chemicals that come from plants. So when you're busy eating carbohydrate and protein and fat and oil, it's also important that you look out for things like phytochemicals. Like, for instance, if you talk about antioxidants, we are talking about the other spices that you use to cook: cinnamon, turmeric, ginger, garlic, sesame, rosemary. So, before, when we were growing up, we didn't know all those things were really, really important. But right now, we're now learning that beyond the carbohydrate, protein, mineral, fats, these other things, and that's why it's important that if you want to improve your nutrition, When you are done serving your food in the plate, ask yourself, how many colors of food are on my plate? That's where phytochemicals come in. So the more the color, the more nutritious your food is. Now, when I mean color, I don't mean color that they added when they were producing the food. Like these color additives in some carbonated drinks that you have yellow, that's not what I mean. I mean natural occurring, the way it was maybe created, or for instance, like I say, tomatoes, I use tomatoes, for instance, banana, we have purple cabbage, you have eggplant, you have cucumber, all those red color, yellow pepper, those things are called phytochemicals. So they just come together in collaboration with your rice, beans, plantain, and all of those things. So the more the colorful your food is, the more nutritious. Yam, someone is saying yam, yes. For instance, now, if I want to make my yam more, I'm not saying yam and egg sauce is bad. No, it's really okay. But you can diversify it. Today, I'm going to have yam and egg sauce. Tomorrow, I'm going to do porridge yam. Now, if I'm having yam and egg sauce, how many colors do I have? White yam, for instance, maybe yellow yam, or depending on the one you have in your location. And then you have egg. Egg is white. You add tomatoes, that's red. You add pepper, that's red. For instance, you just add vegetable, that's green. How many colors is that? That's like 4 or 5 colors. The next day, I can say, okay, today I want to just try something and I want to do porridge. Now, the yam was white. I added palm oil. I added pepper. I added green vegetables. That's another meal. Still yam, but in another form. So I want to just say to us that colors are really important when you are talking about nutrition. And nutrition cannot be spoken about without not emphasizing on the quantity and quality of what you are eating per time. Now, if I'm hungry and I offer you bread and a bottle of soda, let me say, for instance, Coke, and I offer you bread, 1 boiled egg, and bottled water, which one will you go for? Let me say that again. I gave you bread and a bottle of maybe Coke or Fanta, and I gave you bread, 1 boiled egg, and bottled water. Which one will you go for? Someone say bottled water. Okay. So the second one. Okay, thank you. So they're both meals. Bread and Coke is something. I'm hungry. Like I'm really hungry and I can't wait till I get home. I'm really hungry. I have to eat something, and I just do bread and Coke. But if I do bread, egg, and water, that's going to give me more nutrition. It's not only going to give me energy, it's going to give me nutrition, the right nutrients. But if I'm just having bread and Coke, for instance, I'm not getting nutrients. I'm only just getting energy. So now I always tell people that when you want to talk about energy or calorie, you either do premium or nothing. So half of the 2 meals, 1 meal is giving me premium calorie. The other one is just giving me empty calorie, no calorie. Are we together? So as a pregnant woman, you want to be intentional about the meals that you're eating. Next slide, please. Next slide, please. Okay. So why is nutrition important in pregnancy? Of course, nutrition is important for everybody. As long as you're a living being that eats, nutrition is important for you. But emphasis, like I said earlier, is because you're bringing, you know what it means to bring a new life to being. Like that's the only experience in the world that brings another life from a life. So it's a lot. So I said here that nutrition is important in pregnancy because nutrition needs to be met at every stage at every stage of life, from preconception to old age. Preconception means that you are just thinking that I can't come to that and say, I feel like having a baby. I just think I want to have a baby, or we're preparing for our wedding and all of those things. While you're doing marriage counseling, while you're shopping, I hope you've also shopped for antenatal, and then you're also adjusting your meals because you're preparing to have a baby. So it's important every stage of life. Nutrition is very important. Now, because nutritional status at one stage influences the health status in another stage. And let me explain. Imagine that a woman is underweight, for instance, let's say a 19-year-old girl who just incidentally got pregnant and was severely underweight. Just imagine what the weight of the baby is going to be. Automatically, number one, the nutrients she has is not even enough to sustain her. Now, you now brought another life. And don't forget that the baby is going to live extensively especially from what the mother is taking from. So the child cannot have sufficient enough nutrients to take care. So there's a possibility that that child will be born either malnourished underweight. And when you are underweight, you are prone to having different forms of malnutrition. From the stunting to and we can all agree that once a child is not well fed or malnourished, their cognitive abilities, they will be stunted. They'll be teaching in class, they'll be slow to grab. People are learning A, people have moved to D, they are seeing A. Everybody have done A, B, C, D, E. Your child is still doing A. You know, the other colleagues are going to the other class and is still feeling like, no, I'm not learning enough. So that's why it's important that nutrition starts us in one stage. So it's like someone going from primary 1 to primary 2. If you don't pass primary 1 and you go to primary 2, you are likely going to repeat primary 2 because what you ought to have learned in primary 1, you didn't learn it. Same goes with nutrition. So if what you should have gotten, your body should have gotten while it was in the womb, if you don't give that child what it needs, when it comes out, there's going to be consequences. So the nutritional health at one stage of life always influences the health status in the other stages. Same thing when a child is maybe a toddler and has not yet gone to school. Someone said nutrition is like enrolling to a lifelong school. Exactly. So that's just it. So support, another thing nutrition is important is support fetal growth and development. Now, like I said earlier, that the first 6 to 7 weeks of a woman's, when a woman is pregnant, the key organs of the body have been formed. So if the nutrients the body has as a woman who's pregnant is not sufficient, you cannot, the fetal growth means the mental growth and development, the lungs, the cells, the tissues, the organs will not fully be formed. Yeah, so it also helps to enhance maternal recovery. So after delivery, if your nutrition was sufficient before pregnancy and during pregnancy, it is very easy to recover after pregnancy. Maybe there were paravental, maybe there were infections when you were pregnant, maybe there were health conditions and all of those things that we'll see subsequently. You know, it also improves the cognitive abilities of the baby. I have said that earlier, that if you start, I'll tell us later in the slide what kind of nutrients to take to improve your child's cognitive abilities and support overall health. The truth is that medicine is important, but I always tell people that diet plus medications always gives us a better overall health. So even when you have had your checkups here and there, you've tested, you've done your scans, also ensure that your nutrition is in place. Next slide, please. All right, so what are the essential key nutrients for pregnancy? People always ask me this question. Oh, okay, now you said we should improve our nutrition. What should we now be eating? Now, remember I said that nutrition is food at work in the body. Now, when you eat food, the body does not just use rice. Maybe you ate rice, for instance, rice and beans, and maybe you ate it with stew or with fish. So the body will not just use rice the way it is. That's why God is just great. He created all what we ever need to sustain a good life. He gave it to us, which is our digestive system. So the moment your food gets into your mouth, digestion has already taken place from the mouth to the esophagus, down to the stomach and all of that. So those nutrients are what your body converts the food into is nutrients. And these nutrients are the building blocks in your body. And for instance, protein are the key building blocks. I always tell people that protein, especially for a nursing mother for children, are like the foundation of a building. Am I saying carbs are bad? No, but I'm saying that protein are the things that are like the foundation, the building blocks. The ones responsible in forming your tissues, your organs, and so it's important that your protein intake is increased because a new being is being formed. So you have to also eat so that as you're eating well, the child will also get that nutrition from you to ensure that they are growing well. Then another thing that we also need as a pregnant woman is iron. Now, why is iron important? Remember that firstly, as a woman, you have to always ensure that you up your iron game. Because firstly, as a woman, you always have our monthly menstruation, which most of the fact, I always tell people that most of the women on the road are anemic, but they will not agree. You know, we already have menstruation that we're doing every month. You don't mean to lose blood for like 3 to 5 days, you know, once in a month. Some people even do more than that. People that have some other hormonal conditions even lose more than that. Now, that is on its own is already a part that we have not even worked on. Then now talk about when the body is preparing to deliver, you know, during the whole delivery process, blood is lost and all of that. Now, another key reason why you need iron is that when a child is born, the first 6 months of life, Is this the iron stores of the mother that the child will feed from? Let me say that again. The reason why as a pregnant woman you need to up your iron game is because, number one, iron produces red blood cells that carry oxygen around the body. I'm sure we all agree that if somebody, has maybe an accident now or something and stops breathing, you're going to give them artificial oxygen. So if you don't have enough iron, the body cannot produce enough red blood cells. And if there are insufficient red blood cells in the body cannot have enough oxygen. We live with oxygen. Oxygen is the life of a human being. So if there are not enough iron in a woman's being, that child will not get enough oxygen to sustain them till they are born. Now, even when they are born, because we are supposed to be on exclusive breast milk, which means that it's the iron stores that a woman has that the child would use for the first 6 months of life. So it's important that we need to up our iron games. And the next key nutrient that pregnant women need is omega-3 fatty acids. Now, most of these things are got mainly from fat and oil, especially unsaturated oils, for instance, from fish, from flax seeds, from chia seeds, from seafoods generally. You can always get omega-3 fatty acids. Why is this so? It's important for their brain development. Now, the next one is B vitamins, folates. That one, we are very familiar with that. Oh no, once a woman is pregnant, take your prenatal vitamins. So we always we have folic, some people call it folic and some people call it folates, depending on what. So, but B vitamins generally are very, very important because of development, red blood cells, because even with the iron you need also you want to produce in the body, the blood you want to produce also will require B vitamins. Also for brain development, then congenital issues, all these spinal defa, where you see that a baby is having an outgrowth from the spine, all this one, the baby head is very big, all these malformations that happen in children can be prevented if a woman takes in sufficient or enough folates during pregnancy. Another one is vitamin D. Vitamin D and calcium work hand in hand. I always call them like the husband and wife of our bones. So vitamin D and calcium is like the husband and wife of our bones. One cannot do without the other. Now, another thing I want to say is that most of the time when you don't have enough calcium in your diet, is a possibility that you're going to have preeclampsia in pregnancy. And that's not a very good experience you want to have. In fact, I know somebody who recently lost both the baby and the child because of preeclampsia, like say 2 weeks ago at UCH Teaching Hospital. So it is important that these things that we think they are not very important, they are really, really important. So vitamin D and calcium is very important. Then choline is also important as well. And then water. I know that the parts that most pregnant women will say, I don't feel like taking water. You don't have to feel like taking water to drink water. Just give yourself a daily target that, okay, today, this is my water bottle. Even when you're going for antenatal, whether you're going to work, whether you're in the house, set a daily goal and target of the water you take daily. Next slide, please. Now, these key nutrients, where do I get them from? You get them from your daily diet of what you eat. For instance, the first thing, if you want to talk about protein, I mentioned there the MFP factor. Now, this MFP factor will give you two things, iron and protein. Now, one of the richest sources of iron in the body is from animal sources. Even when we say, oh, no, I'm doing fit farm, I don't eat beef, I don't eat this, I don't eat that. It's important that you remember that one of the richest sources of iron that are easily absorbed by the body comes from animal sources. So M means meat, F means fish, and P means protein. Poultry. So M for the meat can be either goat meat, beef, lamb, cow, that our meat now. So it's important that we have them during pregnancy. Then F is fish. Fish can be anything from the mackerel to the herring. Herring is our shower. Mackerel is our Titus. Then it can be catfish. It can be. So I'm just trying to give us different ways that we call fish. If you live in Nigeria like me, the different ways we call fish is just it. We have mackerel, Titus, and all of those. So that's fish. Then for P, we have poultry. So poultry can be turkey, chicken, guinea fowl, all those in that family. So poultry. So those are the key nutrients that you should want to be eating. You can want to eat eggs as well. So eggs contain choline, especially egg yolks. So as a pregnant woman, I want to encourage you. So that myth of, oh, I don't want to eat eggs, it has cholesterol, I don't want to raise my cholesterol level, it's something that used to be a truth before, but is no longer a truth. Now, what really causes high cholesterol most times are usually from saturated foods, saturated fats. So that is usually the major source of cholesterol. But for eggs, it is safe to eat eggs right now. So I always tell people that for an average healthy person, 4 to 5 pieces of eggs per week is fine. For a pregnant woman, let's just say you can up it. Someone's open about yes. 4 to 5 pieces of egg per week is healthy for you. They are a great source. In fact, I can even mention another very rich source. Said the eggs are 5,000. The thing is that, now let me say this. I was having a conversation with somebody recently and I said, I passed through Mushi and I found snails for 1,700 for about 10 pieces. Yes. Now, when you say food is expensive, I get it can be relative. But I'm saying my question is, where are you buying the things from? Are you going to the end users to buy? I mean, the main farmers? Are you if you should buy from these places like ShopRite and the package, you might want to reconsider going to the market. Have your market days, early morning markets. The things are, yeah, it's not as affordable as it used to be before, but we can still get affordable foods right now in Nigeria. It depends on where you want to buy or where you're buying them from. So eggs, turkey, they're fine. Then legumes, I can talk about beans, peas. Now, I noticed that most of the time when it comes to green peas, we only put green peas in our fried rice. And so what happened to putting green peas inside your white rice? Who gave us the formula that only when you are doing fried rice that we put green peas? Where did we learn that thing from? Where did we learn it from? We need to something I don't put in fried rice. So please normalize having white rice and then put peas in them. Those guys are really, really good source of nutrients. For instance, if you're making stew, I will try making stew and adding green peppers to it. It gives you a very nice flavor, gives you a nice taste. If I don't need much spices when you use green pepper to make your stew, add it together with your tomatoes, bawa, and all of those things. Add green pepper, you'll be amazed. Then we have soya bean as well. So we have soya beans as well. Soya beans is one of the underrated source of protein that we don't look at. And I don't know why, but because I'm a researcher, I've been privileged to work in very remote areas, maybe in the southwest, maybe even in the north. I remember when I went to Nigeria in February for a research, we ate wara. They call it wara, local cheese, we have the one that is made from soya and the one that is made from cow. So I really, really enjoyed it. Normally it's not really around, but if you're privileged to be in any part of the world and you find soya bean, whether it's soya bean powder, whether it's soya bean milk, whether it's tofu itself, please leverage on enjoying what is available. Don't because vote, or don't feel like, oh, there's a rich man food and the poor man food, what is for poor men. And no, don't say that. There's not like rich man and poor man food. All the foods that we have available have their different nutrition and different variety of nutrients that it gives to the body. Now, nuts and seeds. So nuts, it can be peanuts. Peanuts also known as granules. Peanuts, it can be cashew nut, it can be coconut, it can be someone said tofu bisque. This person, if person knows what's going on. I love bisque wara. I really enjoyed. I really enjoyed it. I don't really know how to make it properly. I wish I know, and I'm going to still learn so I can make it myself. But I really enjoyed when I went to those areas that it was really, really available. I bought and I maximized it. So nuts, we have groundnuts, peanuts, cashew nuts, almond nuts, so hazelnuts. So anyone that is available, please enjoy them. Seeds, it can be flax seeds, it can be chia seeds, any of those are rich sources of nutrients. Like I said, the other antioxidants and the phytochemicals that we don't really pay attention to, seeds always give. And then also omega-3 fatty acids, we can get them from seeds. Now, fruits and colored / dark green vegetables. Now, I want to stay here. I noticed that most pregnant women all of a sudden lose taste for fruits and vegetables. I get that you have cravings, yeah, but you also have to be intentional about the fact that you are taking care of yourself and for your baby. And I always stop with that nutrition is like a bank. Is what you save that you will withdraw. There's no magic. Yeah, there's no magic. Nutrition is like a bank. Is what if I save, in fact, there's interest. If I save, for instance, 5 million naira somewhere, I can go back and get 5 million naira. So no one's gonna come and save you. So food, that's what thing is done. Is what you give your body. Most of us trying, why it is called essential is because the body cannot produce it. It can only be gotten from food. That's why they are called essential. There are non-essential nutrients and there are essential nutrients. So essential means that the body cannot produce it. You only have to get it from food. That's why it's important for us not to joke with our fruits and vegetables. Now, especially for a pregnant woman, you know that one of the richest sources of folate or folic acid is dark green vegetables. And it depends on which part of the world you're watching me from, whether you're from the west, south, north. We have, Nigeria is blessed with vegetables. From shoko to afang leaf to oha in the east to name it, saint leaf, efinrin, just name it. We have a lot. Greens, green, efo tete, efo riro, efo, there's just a lot, you know. So please, let's leverage on the green vegetables that we have and ensure that gone are the days where you should be making egusi and porridge jam without vegetable. In 2024, please, where are you from? Are you still a Nigerian? So it's important that you enjoy fruits, especially fruits in season, banana, orange, pawpaw. There are just a lot of them. And I forgot to mention tiger nut as well in the nut family. It's something that you want to really, really enjoy this season. Then dairy, you know, enjoy dairy is a rich source of calcium and vitamin. You know, I mentioned earlier that you don't take vitamin D away from calcium. And those are the rich sources of, don't play with your dairy. And if you don't have enough calcium in your body when you're pregnant, there's a possibility that you're going to have preeclampsia. So start now and build your calcium bank. Now, the grains and starches, these are our staples. We eat them on a daily. We have rice, we have yam, we have potatoes, we have millet, we have corn, we have all manner. So now let me also say this. Just because I said it's high protein does not mean that you should not eat your carbs. There's something called protein sparing effect. If you don't eat enough carbohydrates, your body is going to convert the energy from protein to work with it. So when you're eating your carbohydrates, also eat your protein as well. Next slide, please. All right, so what are the foods to avoid during pregnancy? There are a lot. There are plenty. I could not just sit here. There are a lot. Number one, taking alcohol. No amount of alcohol is safe in pregnancy. Should I say that again? Should I get a mic so that those at the back can hear me? No amount of alcohol is safe in pregnancy. Why am I saying so? I've seen complications that have been. In fact, I knew a woman that her child died at 13 months, and she didn't know she was pregnant for the first few weeks, and she was going out, having fun, taking alcohol, and all of that. And then when that baby was born, there were complications. Number one, the child, the bones were not formed properly. So the child could not even stand. It was feeling no sensitivity in the nerves. So we managed the loot, but eventually we lost the baby at 13th month. So it's important when I say that no amount of alcohol is safe in pregnancy. Then I talked about hot dog, processed food like candy. I'm craving candy. I'm craving the kiniko on the island. I'm craving, you just be craving weird things. Every day I eat shawarma. You alone, shawarma and 4 hot dogs. Shawarma and 4 hot dogs. Shawarma and 4 hot dogs. Shawarma. So you're feeding your body with non-nutrients. And then you expose yourself to complications like gestational diabetes, expose yourself to things like preeclampsia, high blood pressure, cholesterol problems, obesity, and all of that. Because what this thing does give to you is empty calorie. Now, I mentioned that when you want to do calorie in pregnancy, do premium calorie, not nothing calorie. Thank you. So when you're also eating eggs, doing eggs, seafoods, meats, ensure that they are properly cooked. Now, I get that you like to buy all this roasted fish and meat on the road. When you're buying them, ensure that they are properly cooked or properly done. Someone said, what's wrong with liver? Okay, I'll say this. So liver is a very good source of iron, but too much of it can cause toxicity of vitamin A, which can be a risk factor for all these diseases in children, all these deformity, congenital issues. So if you're having liver, you want to have them in little quantity. But I always advise people that instead of you eating liver, just stay away from it during pregnancy, because it contains excess of vitamin A, which can, too much of it, not if it's bad, no one person can eat it, but exposure during pregnancy is not safe. So as a pregnant woman, whatever you are doing is you're looking at safety when it comes to food, not just the quantity. Like I said earlier, I even removed something here, but let me just add it now. So how do you ensure that your food is safe? Ensure that it's properly cooked, it's properly washed, it's clean, and it's at the right temperature. Don't eat a food that you are in doubt in. If you are ever in doubt of a food, please throw it away, because you expose yourself to foodborne illnesses. Remember that as a pregnant woman, you cannot just take drugs anyhow. A girl or a lady who's not pregnant can wake up and say, I'm stooling, and just take Flagyl or just take any other, random out of over-the-counter medication. But for a pregnant woman, you have to be extra cautious, because your body is already in a compromised state that exposes you to more infection than somebody who is not pregnant. So that's why I'm saying that liver, little, then coffee, too much of caffeine. So caffeine is not only in coffee, but most of the energy drinks that we take today exposes us a lot to all these things. Next slide, please. All right. So what are nutritional concerns in pregnancy? This is nutrition related. There are other concerns, but this one is nutrition related. For instance, gestational diabetes. I remember last month when I did a program, I had 2 pregnant women I managed, and got so kind that I was at 29 weeks. Yes, we managed them. Their blood pressure, their glucose level was off the roof. In fact, one even told me that doctor told her if she does not manage it, she's going to be on insulin. And he ran to me and said, please come, let's work with that. And then eventually, after a while, we did a meal plan. She started working with, and then her glucose level was controlled. So gestational diabetes is something you want to manage in pregnancy. Do you know why? If you don't manage it, even after you give birth, there's going to be a recurrence, or you have type 2 diabetes later on in life. So it's important that you just prevent it now. You don't have to wait till that time. So it's very unsafe for your health, your baby, and for you. Then constipation. Now, I know that most pregnant women, when they begin to get towards the end of their pregnancy, maybe as the baby is growing, it tends to rest on their GIT, which gives them discomfort. So for those that are constipated, I always recommend that you have a good sleeping posture, watch what you're eating, the timing that you are eating, don't eat too late. Then under constipation, some people can have heartburn. So if you're having heartburn, you want to be careful of don't eat too much spicy food. Just eat small but frequent meals. You can have a first meal maybe by 8, have the next one by 11, 12, have the next one by 3, have the next one like 6, 7. So don't just, because you are really craving hunger, you just pack one full, and then, amala, you now do 2 shaki, 2 pomo, you now pack everything together. Like you just pack a lot of food at the same time, because of how you are craving or how hungry you are. That can result in either constipation or heartburn. Then preeclampsia, I had mentioned sometimes, can be a result of high blood pressure and other factors that happens in pregnancy. So do all you can, move around, be fit. Don't just be, I'm pregnant, I can't lift my hand. No, do it. Take your calcium levels, take your calcium. If you're giving any calcium supplements, take them. If not, just ensure that you're having proper quantities of calcium and vitamin D. Then nausea and vomiting. Nausea and vomiting can be common, same thing as morning sickness. You want to ensure that you're having stuff like mint in your water. Like for instance, I know that I can tell people that if there are no issues in your pregnancy, you can have mint or lemon in your bottled water, so that helps your taste buds not to feel nauseated. You can also have mint leaf, lemon. Also you can cook with maybe ginger, garlic. It would really help and then feel better. Then vitamin deficiency, whether it's B, whether it's C. Then C is very important, because Eat peppers, eat your oranges, eat your fruits as well. They are very rich in vitamin C. Then anemia, we talked about iron. So when you don't have enough iron in your body, it will result in anemia. So next slide, please. Are we almost done? Oh, I'm not almost done. Okay, so this particular slide is what I usually don't add to my slide, but I added it this time around because I want to just talk about it. Food myths and beliefs in pregnancy. It's better to rely on vitamins rather than diet. So, as people say, oh, I'm taking my vitamins. I bought my supplements. They are called supplements for a reason. They're supposed to supplement, not to substitute. Let me say that again. Your vitamins or your supplements are to supplement your meal, not to substitute your meal. So they are called supplements for a reason. So, and like, let me say that no supplements can give you all the nutrients that your body needs. Yeah. No single supplement can give you, don't let anybody bamboozle you. Everybody is selling their market, and I don't have a problem with that. But no single supplement can give you all the nutrients that your body needs. So that's why it's important that even when you have supplements, you have your prenatal vitamins, ensure that you are having adequate diet. That's number one. Number two, you are eating for two. Remember that the weight that you are adding by saying you are eating for two is waiting for you after delivery. So it will be more challenging that you want to maintain adequate weight. Now, let me talk about weight for a little. For the first trimester of pregnancy, for the first 3 months, you are not expected to add any extra weight. Just eat your normal meals. Let your food be more rich in fruits and vegetables. Not you take 2 bottles of Coke in the morning and now say, this evening, can I have la casera in the evening? Wake up in the morning, 1 pack of processed yogurt. You now download that one first. So you just be eating, this guy should, you now take pap, 1 full bowl of pap. You now say, this guy should eat for 2. Pepper soup is passing. Let me call pepper soup. Abacha. Let me call abacha. You just be calling everything that is passing on the streets just because you are pregnant. Hello, auntie. So you are not eating for 2, you're eating for 1, even though you are carrying a live baby. So please take notes. Like I said, the weight that you are eating is waiting for you after you give birth. It's a bank, it's what you save that you will take out of it. So eat adequate meals. Ensure that, like I said, you're eating calories that are premium and not nothing. Now, the next point, next myth is whatever I crave for, I must eat. Someone says hello, auntie, for me. Whatever I crave for, I must eat. So there's something in pregnancy that I'm craving this. I'm craving, you live in, for instance, you live in Lekki. You not say, is that amala and Abet Macaulay yaba that I want to be craving? It's the one I'm craving right now. You know, is that amala? Is that kiniko? So, or you crave for weird things that are not food. You feel like chewing maybe nail, you feel like chewing pica, you feel like eating potash, you know, those weird cravings that we have that is not food. So I'm of the opinion that you have the power to control your cravings when you tell yourself that this thing I'm eating, just I'm craving party rice. You know, so please don't eat things that are not nutritious to your body. Shweta said, and that myth is now you are pregnant, you now start taking folic acid. You know, I mentioned earlier that you don't start taking folic acid when you are pregnant. It's when you want to think, when you start thinking, before the pregnancy falls on you. Before it falls on you. Because you say it's to fall on you. Before the pregnancy falls on you, please start taking folic acid. Yes, start taking folic acid. Then some people say, oh, because I'm pregnant, it's just only high protein I'm going to be eating. No, I said earlier that you eat carbohydrate and you also eat protein. If you don't eat enough carbohydrate for your body will take the energy from the protein and use as carbohydrates, which means that the work that protein is supposed to do in the body, it will not do it sufficiently. Then the next wrong belief or wrong myth is that you want to lose weight when you are pregnant. Hello. That's why it's important that you always know your weight before you get pregnant. Most of the time, when we're managing patients that have gestational diabetes, I always ask them that, what was your pre-pregnancy weight? I don't know. I can't remember. It's okay to have, see, just the way you know, every human being should know their weight per time. Just when you know your account balance, you should be able to know your weight, your height, your waist circumference, your hip circumference, whether you're a male or female. It's just a way it helps you understand your health status. It's just very basic things that you should just know about yourself. I should not be asking you, what's your weight? You say, the weight, when I was single like 3 years ago, that's when I checked my weight last. No. When you now go married, your mind became, you started eating anyhow you like, you're in your husband's house, you're not checking your weight, you're just eating. So it's important that it's not okay to lose weight while you're pregnant because you already have a life you're trying to protect and take care of. Next slide, please. So now we have come to nutrition after pregnancy. So you've carried the baby for 9 months. You are doing just fine. You're doing just okay. And all of that. So nutrition after pregnancy is when you give birth, what next? So the first thing is, I'm sure during antenatal, nurses would have told you how to take care of your breast, how to start prepping you for how to prepare your breast and your body for breastfeeding. So I said here, breast milk is the main source of energy and nutrients for the newborn baby. Now, I know that our mothers used to have their opinion. My grandma, my mommy said, my auntie said, this is 21st century and things have changed. Except when maybe you are not able to, maybe there are complications during delivery and blah, blah, blah. But if all conditions are okay, everything is fine, it's important that you put your baby to breast. Now, it's always important to put your baby to breast the moment you have delivered. Something called colostrum. Colostrum is the first breast milk that comes, I think, in the first 24 hours of a child being born. Your baby needs it. It's like you know the way when you want to start, it's like when you change oil in a generator, not fuel now. So that's what colostrum does. It changes the whole gut health of that baby. So it's very important that as a pregnant woman that you ensure that you put a baby to breast the moment you give birth to your baby. And breast milk has all the energy and nutrients that your body needs. No water, not they say take this particular one just to help. It's not agbo. Holy Spirit, thank you. It's not agbo. Because I can see people give their children, even when you are pregnant, it's not taking agbo when you are pregnant. When you are pregnant, don't take agbo. Because you can't properly quantify the nutrients. I've seen people have issues, liver problems in pregnancy, kidney problems in pregnancy. You give birth to a baby, you're battling baby, and then you're also battling kidney problem. Some say, what's agbo? Please help me interpret what's agbo. Okay, so don't give a baby agbo. Don't, about concussion and all of those stuff. So please don't give a baby that. Breast milk is perfect. So now the composition and output of your milk is likely to be affected by the mother's diet and state of nutrition. Now, because it's an hormonal and psychological thing, you want to ensure that as a mother, you start preparing your mind for breast milk. And then what you are taking per time. Eat healthy meals. Don't say because you are breastfeeding now, your mother says you go and bring 5 jugs of tea. You should not drink 5 jugs of tea. When you now bring 2 bowls of pap. They brought tea around 6 o'clock after they bath in the morning. When they now finish around 11, they now brought 2 bowls of pap. When they now finish around 12, they now brought pepper soup, very big one. Because you are breastfeeding. No. One of the major oil, you want to go and say, drink palm wine. When you drink palm wine, the breast milk will just be flowing. These things are not scientifically proven. I will tell you the truth because I've seen a lot. So it's important that as a nursing mother, just someone say papa water. Which one is that one again? It's important that you just maintain a healthy diet. Also, I said that the amount of nutrients you need to eat depends on your weight before pregnancy, your activity level, and how many babies you're breastfeeding. So maybe you're having twins, triplets, small but frequent. Just be moderate. Take water. Take a lot of fluid because that's what really helps in breast milk. Take a lot of fluids. Take a lot of just listen to whatever your what do they call them? Your nurses advise you doing just prepare your body for your baby. Just feed them well, eat your food, eat your vegetables, take your fluid, take your juices, take your teas. Just be good. Don't overdo it. Like I said, when you finish taking all those pap and you have done winning the baby, the extra weight is waiting for you at the junction or at your door. You will still pick it up and continue the journey. Amen. So let's go ahead, please. Next slide, please. Okay, so what are the benefits of breastfeeding? Because I get that most women are beginning to feel like, oh, I'm a career woman, I don't want to breastfeed. My breast is going to sag. All those plenty excuses. The moment you decide that you want to bring another person to this world, you have to ensure that you are ready for it, to make the sacrifices, to make the inconveniences around that. So I'm talking about the benefit of breastfeeding now. Breastfeeding allows the child and the mother to bond. There's this bond that happens, during breastfeeding. So for moms, it's important that you do breastfeeding. Breastfeeding may not be easy, but it's convenient and cost effective. Because how much is baby milk now? I mean, I can't even remember, I don't know. Where we find out. So imagine saving that baby milk for someone say, what about pumping? Yes, pumping is okay as long as it's breast milk. Someone said I saw one for 80 kg. So imagine saving what you should have bought the milk. And these days, people just take different kinds of milk. And please, even when you are done with breastfeeding and you want to go into complementary feeding, please give age-appropriate milk to your children. Don't buy one sachet of cowbell, now pour inside a 1 liter of water and say, this is the milk baby will be taking. There's no nutrient in it. The baby may not be able to absorb it and all of those stuff. So but I will advise you, the money that you will spend to buy milk, do breast milk, and be saving it for 6 months or at least 4 months. Let's just say, okay, a career person, you don't have time, at least 4 months. Save it. And then use it later on when it's not time to now start introducing complementary feeding to the child from 6 months and all of that. You now start. So breast milk may not be easy, but it's convenient and it's cost effective. You can bring it out anywhere. You don't have to start going to go and boil water. You don't have to start prepare. And then it reduces the risk of infection that children get from those bottles we use, both the feeding bottles, the spoons, all of those stuffs. It reduces the risk of infection for children. It also boosts their immunity. So for here, it said it allows your uterus to return back to the normal size and reduce blood loss. Also reduces the risk of cancer in women, heart disease, diabetes, and arthritis. Next slide, please. Next slide, please. Okay, for the babies now. So one of the things I like about breastfeeding is that it helps to, I stumbled on a study recently that says that when you introduce a child to formula early, you expose that child to having allergies. So that's why it's important that, the way some things have just been designed to help our life, but we have decided in our own mind that we want to complicate matters. Everything has already been designed. I've seen someone give a child golden one that is less than 6 months. When on the pack, they say ideal for children 3 years and above. Why would they give a child less than 1 month or 1 year honey when they don't have the ability to digest it? All those things are going to expose that child to asthma, allergy, and diarrhea. And you have compromised immunity in those children. Today, your child is in the hospital, you are spending money, so you're having sepsis, you're having infection, you're having this, you're having that. But you didn't use the breast milk to boost their immune system. So why won't you have all those issues? Then you find that some of those children don't become really, really big because they are on formula. So you reduce the risk of obesity and diabetes in those children. Children that are breastfed are likely to need less medical attention as they are growing, thereby reducing your healthcare costs. So breastfed children have better cognitive abilities. Better cognitive abilities, hence increasing productivity at work. I want my baby to be big. There's an ideal weight for a baby. So they says that when a child is 6 months, is it 6 months now or 4 months, it's supposed to double the birth weight, and at about a year, it's supposed to triple the birth. So that's just a basic thing. So there's no competition. Don't say child A, the child of Mama Tina is becoming big and healthy, my own baby is slim. No, don't compare. Go to the hospital, check the weight charts, the growth charts. Let them tell you if your baby is within the healthy weight range or not. That should be your focus. I also said here that fuel consumption is reduced, in infants when they are preparing formula, when breastfeeding should be the right thing to do. Next slide, please. Next slide. Yep. In conclusion, finally, we are done. Pregnancy and the time after you deliver your baby can be wonderful, exciting, emotional, stressful, and tiring at once. But making changes with a healthy lifestyle gives your baby the best possible start on life. I always tell people that don't be a parent that instead of leaving inheritance for your children, you leave sicknesses for them. Because almost every illness we have now is hereditary. And also, I've also noticed that for the first 7 years of a child's life, research has shown that the child does not have the ability to choose what to eat. It's what you and I give them that they will eat. So it's important that we give our babies a good start from when they are pregnant. And then also don't be a parent that tells the child to eat A and you are eating B. That's why I said be a healthy example to your family. Don't say, no, go and take yogurt, but you drank like 4 bottles of energy drink between yesterday and today. The child will be like, these Gen Z children, they are very, very curious. Not like our own time that your mother tells you one thing, you just obey, you don't ask questions. This generation they are watching what you are doing. So even as an adult, you want to lay good example for your children to be able to have, called a lifestyle, it's a marathon. So lifestyle means the way they live. So if you start incorporating in them that fruits are important for you, start to bring in healthy diet for them as early on, they would live with it even for the rest of their life. So I hope with these few words of mine, I've been able to convince you that you should take your health seriously. Take your nutrition seriously.
Wow. Thank you so much, Mrs. Deva. This has been a very insightful, robust session. I want to see us expressing in the chat box, our feedback as to how the session has gone, the value-loaded insights we were getting. It was very, I feel like there was no aspect that it didn't touch on. It was very expansive, from addressing even the need for the before pregnancy, that nutrition starts preconception. She taught us about how nutrition is like a lifelong school, how that she even used banking examples, the different life principles that she brought into this session. It has truly been insightful and very practical as well. A very immediate examples that we can all relate with in our environment about key nutrients, some of where these food sources are, and some of the myths and beliefs that misconceptions that we should be wary about, and that we can also influence others about, because these sessions are not only for our learning but also going forward as well. I thank you so much, Ms. This has been very robust. I know that we're trying to round off quickly, but I just want us to quickly take a few questions before we take our pre-test post-test quiz. I know somebody asked from our YouTube participants and audience. Thank you so much for joining and participating as well. Somebody asked, what is the difference between coffee and beverages? Can you please just throw a little more light on that question?
Okay.
And the importance of it, I guess.
Coffee is a type of beverage. Beverage is just anything liquid. Yeah. So I think for me, beverage is anything liquid, from alcohol to tea to carbonated drinks and all of those things. So caffeine is made. Okay, so I think coffee, yes, is a compound name for everything. Most of it, everything fluid. So that's just beverage is anything. So beverage is not only your chocolate, Milo, and Ovaltine drink with milk. That's not beverage that we used to know. Beverage is a compound, umbrella name for fluid. So that's but coffee is coffee. It has caffeine. And most of the energy drinks that we have now, carbonated drinks that we have now, all have elements of caffeine, which is not very healthy for brain development of both you as an adult and for your child.
As well. Thank you. One quick last question. This person is asking, what of babies that are born through surrogacy? how else would they bond? Because we're speaking of small benefits for breastfeeding. How would they bond aside the mom's breast milk?
Those are special cases. When they are done, when the whole process is done and all of that, it's okay to start having your baby. Those are external cases. Or when you spend time with a child, you bond. But ideally, you know, so yes, you can still bond even when when you spend time with a child. Yeah.
Okay. I know I said last question, but this person just dropped this question. Please, doc, can you continue breastfeeding a 7 month-old baby when you notice you're pregnant? If yes, please can the mother take folic acid and blood tonic while breastfeeding? Are there diets to avoid both?
Okay, I didn't get the first one. The first one was like, I'm 7 months pregnant. Can I continue breastfeeding? I usually advise that the moment you're pregnant, stop breastfeeding if that child is up to 6 months, because it's going to be overwhelming. It's going to be overwhelming. As a woman, we have to really take care of your health as well. It can be mentally draining. And that's where the whole postpartum depression thing comes from and all of those stuff. So once you find that your baby has maybe been good 4, 5, 6 months max, and you're pregnant, it's okay to stop the child. Introduce other things to the child, and then maybe once, but don't solely. I know someone that breastfed their child till. I have a friend till almost 2 years. Now she doesn't have any other baby, so she has all the time in the world to sit with that. But for you who already has a new baby coming, no. So that for mental sake and then for your body to also rest and reset.
Wonderful. Thank you so much. I think thank you so much, Dr. Ms. Sudeme, for this very wonderful, insightful presentation, and the many lessons that we're going away with. But before we round up, I want to quickly take our post-test quiz so that we can measure our knowledge gain. So please, I want to encourage everyone who took the post-test quiz to please make sure that they take the pre-test quiz, to please make sure that they take the post-test quiz as well. So it's coming up now. If you can't see it on your screen, please look at the 3 dots at the bottom so that you can you'll see more or 3 dots. Just click on it so that the questions can pop up on your screen. We'll also share for our YouTube participants the post-test quiz as well, so that you can as well. Thank you so much, everyone. All right, I see our answers coming in. Thank you so much. We'll quickly just run through that so that our speaker can give us just run us through like the question and the answer before we have to leave. But thank you so much, everyone. I'm sure that by now, after the many insights we've gotten from this session, we're gearing to go. It's just tick all the right options. But no worries, your answers and responses are anonymous. This is just for us to learn and measure the insights we gained from this session. Thank you so much. All right, please keep your answers coming in. We've also shared the post-test quiz for our audience from YouTube. Please, we're encouraging you to also participate and be a part of the post-test quiz. This is very important for us. Thank you so much. Thank you for your responses. Please keep them coming up so we can round this off in the next 1 minute, please. If you took the pre-test, please make sure that you take the post-test as well. And even if you didn't take the pre-test, please make sure that you take the post-test quiz as well. We are coming up to the end of the session, and we would like to receive as many of your responses as possible. So if you're in the room, please make sure that you take the post-test quiz. Thank you so much, everyone. Thank you. I see your responses coming in. Thank you so, so much. All right, we're bringing this shortly to a close in the next few seconds. So if you're taking it, we're waiting for you to just round up so that we can round off this call. Okay, thank you so much, everyone. We're in the call now, and we will quickly just run through the questions. The first question, Mr. Deme, just will kindly appeal that you unmute so that you can provide guidance as we answer these questions for the benefit of everyone. So the first question, which nutrient is essential for breast milk production after pregnancy? We have about 4 options here: protein, vitamin D, iron, and galactogs, example, fenugreek. So what's the correct option, please?
Give me a minute.
All right, sure thing.
Okay, omega-3 fatty acids because of brain development.
Okay, okay. So, but from the options here, I think that the answer for this one, I think there was another one that had the omega-3.
Oh, okay, sorry. Protein. Yeah, sorry,
all right.
protein.
All right, thank you so much. I know there was a mix, yes. Okay, number 2, which of the following is not a reason why pregnant women need to take, our speaker spent some time talking about the importance of taking, folic acid during pregnancy. So option 1, it helps prevent brain and spine defects in the baby. Number 2, it supports the mother's energy levels during pregnancy. Number 3, it reduces the risk of complications during childbirth. And number 4, it improves the baby's hair growth in the womb.
Brain. And I see brain.
Yeah. So it's not correct to say that taking folic acid during pregnancy will improve baby's hair growth in the womb. Yes. So that's the right option. That was sort of like a trick, one of those trick questions, but thank you, everyone. What is the best source of calcium for pregnant women? We have dairy products, we have leafy greens, we have nuts and seeds, we have fortified cereals. What is
dairy products? Dairy products.
All right, thank you so much. The next is, which food group should women avoid to lower the risk of harmful bacteria like Listeria? A, raw fruits and vegetables. B, raw meat and poultry. C, unpasteurized dairy products and soft cheeses. D, processed meats? If you were listening, I'm sure you know the answer to this question.
Yeah, unpasteurized.
Unpasteurized,
You want
because
to
she
be
spoke
sure
about this.
that you're having the right milk, not just ones
Yes,
that you just take from the cow. They've not yet gone through that process of pasteurization.
yes, yes. Thank you so much. What is the recommended duration of exclusive breastfeeding? Oh, we flogged this quite a bit. A, 3 months. B, 6 months. C, 9 months. And
They
D,
know the
12
answer
months.
now. Should I be answering that one again? They all know
We should be
to be honest.
chorusing the answer. Is 6 months. Okay. Which food is high in iron and recommended for pregnant women? She spoke about iron, the need for us to up our iron game. I hope you remember that. Option A, red meats. Option B, spinach. Option C, beans and lentils. And D, all of the above.
All of the above.
So we know that the answer
Spinach,
is all.
vegetable, any green vegetables, fine.
Every.
Red meats, beans, and lentils.
Wonderful. What is the role of omega-3 fatty acids during pregnancy? A, fetal heart development. B, brain development for the baby. C, maternal immune system support. And D, all of the above.
Brain development.
Brain development. Okay, thank you so much. 8, what are good sources of folates? We talk about this to prevent neural defects as brain and spine defects in newborns. A, chocolate drinks. B, processed foods. C, fruits and vegetables. D, milk.
Milk. What was the question again? Sources
Sorry,
of
good sources of folates to prevent
okay,
neural
folates.
defects.
What are the options again?
Chocolate drinks, processed foods, fruits and vegetables, and milk.
Fruits and vegetables.
Fruits and vegetables. Thank you so, so much. Really, really grateful to everyone who participated in the post quiz session. We have come to the end of today's session. Please, next slide, please. And we really want to just quickly take a quick reaction survey. It's just 5 questions. It won't take your time. We want to know how the session benefited you, what you are going away with, and just to help us improve going forward. So let's quickly just do this in 1 minute, okay? You're not writing a lot of just ticking the points, the options. Let's see how this can improve or help us. And while you're doing that, please, would like you to share in the chat or in the comment section questions or topics or that you would like us to talk about or conduct in the future, right? That would also help in driving improvement in health outcomes and also improving your efficacy as an individual. We appreciate your feedback. Thank you so much, everyone. Thank you. I can see that the reaction survey, we're getting our answers coming already. Thank you so much, everyone. Please keep them coming in so that we can round this up in about 40 seconds. In about 40 seconds. Thank you so much. Thank you, thank you, thank you. All right, 30 seconds to go. About 10 seconds more. And we will bring the poll, the reaction survey to a close. Thank you so much to everyone who has filled it so far. Your feedback is very helpful to us. Thank you so, so much. Right, please, if the other topics that you'd like us to address, please put them in the chat as well. And we will take that feedback. Thank you so much. All right, rounding up the poll right about now. Next slide, please. Just before we go, we want to appreciate you for taking the time to join our session, but we'd like to remind you to stay connected so that you are abreast of sessions that we are going to be having in the future. Please follow us on all our social media platforms on Facebook, Instagram, Twitter, and YouTube and LinkedIn as well, so that you are connected and you can always participate or benefit from our sessions going forward. Next slide, we'd love to really appreciate everyone who joined today. We really want to thank our speaker. Please keep, thank you. like to really appreciate our speaker who took the time to digest these things in very practical, bite-sized, very useful ways for us. The learnings were somebody in the comments said it was value loaded and table shattering. She addressed everything, talked from alcohol consumption, to the importance of drinking water, right? And the need to, even if nutrition not just been only about quality, but also about quantity. This was such a balanced, insightful session, and I really, really, mDoc is really, really grateful. We appreciate you, Mr. Deme, for this wonderful session. We thank you so much. I want to thank every one of our participants who commented, who asked questions, who shared emojis. If you shared emoji, we appreciate you as well, right? We took our polls and our quizzes. Thank you so much for making this session a success. We're excited for the outcomes and the improvements that this will translate to in your lives and even the lives of people who are around you as well. Thank you once more, everyone. Wish you a wonderful weekend and do have a good evening. Thank you so much for coming to this session. Bye for now. Thank you very much.
Thank you for having me. Thank you, everyone.
Thank you so much, ma'am. Have a good evening.